It's Dr. Marty Ross here. I'm talking with you from Las Vegas tonight, actually. I'm attending a medical conference here that begins tomorrow, so I flew in today so that I have a chance to do our webinar together. And so you're seeing a little bit of a different setting here. Nice curtain behind me, I guess. Anyhow, and actually, I'll show you this. This is quite interesting. That is the Las Vegas Sphere right out there. So, this place always cracks me up. I'm at a it's called the American Academy of Anti-Aging Medicine has its Longevity Fest medical conference every year in Vegas. I wish they didn't have it here, but this is starting to be a regular home for me around the holidays, unfortunately. And what's always interesting is they have us here in town right now, and then also it's 2 weeks of one of the biggest national rodeos in the country is here right now too. So you got a mix of anti-aging docs and integrative medicine docs along with the cowboys. So it's always interesting around the roulette table and some of the gambling tables. So anyhow, so it is a little bit of a different setup here tonight, and that's why. So the way, for those of you that are new to how our webinar works here in the Zoom room, the way that I'm conducting them is I'm having you write your questions to me using the chat box function, all right? And then I will take the questions one at a time. And the reason I'm having you write them to me rather than using your microphone to tell me the question is we can get through more this way. If you just write it down, I'll read it real quickly and respond. But then if I have some clarifying information that I need of you, I'll ask to talk with you directly. Or I may at the end say, did I answer everything you want? The other thing that's nice about this Zoom room is well, I'll ask for comments from other people, and sometimes we get some interesting help that comes from some of our members. Like last week, we started talking about using red light therapy to help with some of the musculoskeletal pain problems that one of our members was having. And that conversation even continued during the next week off of the webinar, people talking about different products that they have found helpful. So what I really like about this kind of a forum and doing it this way is we can get a lot of input from a lot of smart people, because you're all smart, you live with this illness, right? And with advice from me, and I think sometimes we come up with better solutions than I can even come up with you on my own. So that's how we'll work it here tonight. I am creating a recording. I anticipate trying to get it out to you by around probably 9:30 a.m. Pacific Standard Time tomorrow, because I'm not in Austin right now. So be aware to post it a little bit late. And where you can find that is on the left-hand navigation menu at in Lyme United. There is an area that says Zoom recordings, and you'll find it posted there. I also create a summary of it as well too. You know, I'm getting a little more intricate with those summaries now. So with the help of AI auditing my transcript, I'm able to put that together pretty quickly too. So anyhow, why don't we go ahead and get started here? So let's see, first question. Hold on, I got to get rid of one thing here. All right, so hi, Sherry. So Sherry says, what are your thoughts about the combination treatment of NAD, glutathione, and methylcobalamin? So Sherry, I know there was an article that was recently published at LymeDisease.org where there was a person that wrote about using NAD, glutathione, and methylcobalamin. I haven't actually read her article, so I just want to be clear about that. But what I would say is all of these nutrients can be good. And in fact, two of them, the NAD and glutathione, I do advocate using. So for instance, you may be aware in my Ross Lyme support protocol, one of the steps I say that people should do to help support detox is to use glutathione. But I advocate doing it orally, because I think orally you can get as good of absorption as you can IV in most people, and it's a lot less costly. Okay. And then the other benefit of doing regular glutathione is it is one of the supplements you can take that can help lower inflammation caused by your germs in you. And so your white blood cells, when they see the germs and they see your mold toxins, produce a lot of inflammatory chemicals called cytokines. And glutathione has a mechanism to help lower those cytokines. And so I like using it for that reason. So you see glutathione is something I recommend to take daily in the Ross Lyme support protocol. And so, yes, getting an IV is another way that you can get it. In terms of NAD, nicotinamide, I always botch up on the name of that, but NAD is a chemical that has a number of vital functions. Number one, it is one of the chemicals that you use to make cell energy called ATP. So it helps if you have enough of it, it may help improve mitochondria function. Mitochondria is where your cell energy is made, called ATP. Okay. The other thing that NAD is useful for is and you may, if you read my article, yesterday I posted an article about anti-aging longevity medicine concepts that we could use for Lyme. And one of the things I suggested there was using regular, something called NMN, which is a precursor for NAD. I advocated that using that is helpful. And what it does from an aging standpoint is it helps turn on a group of enzymes called sirtuins. And sirtuins are useful at fixing damaged DNA that you may get as a result of having these illnesses and having a lot of excess oxidation agents. And also, it's very useful at helping your genes get expressed correctly, they get interpreted correctly, okay? And so one of the things that happens when you have chronic infections like Lyme is you get an overproduction by your immune system of oxidizing agents, and those oxidizing agents may injure your DNA and may alter the ability of your genes to be interpreted to make enzymes and to make proteins. NMN and NAD basically cause your sirtuins to work better, which makes it so your DNA gets cleaned up and you get better genetic expression. So yeah, I think and you get some benefit from of your mitochondria function as well too. Now, I don't like using NAD orally because it's unstable and may not get absorbed well out of the gut. Therefore, I recommend using NMN, which I talked about yesterday in my article, and that I recommend getting 800 milligrams a day of that in, okay? NAD is something you would get IV. It's not that stable to give orally, so you could get it IV, and so you would get the benefits I was just talking about. And then in terms of methylcobalamin, I don't think everyone needs methylcobalamin. And I know that this person has found benefit in their protocol, but I think the only people that really need to be on methylcobalamin are people that either have laboratory evidence of vitamin B12 deficiency, or they have something called an MTHFR defect, but and that is MTHFR is an enzyme called methyl-tetrahydrofolate reductase, MTHFR. It's an enzyme that is responsible for taking dietary folate and converting it into an active form of folate. And you need that active form of folate to help with a bunch of detoxification steps, okay? There are two genes that code for that enzyme. One is called the A1298C gene, and there's another one called the C677T gene. And so if you've ever been tested for MTHFR, what they're doing is they're testing to see how both of your copies, the one you got from your mom and the one you got from your dad, are of the C677T gene, and the two copies are of the A1298C gene. Okay, now, the only time I have found it beneficial to have to fix the injury of an MTHFR by using methylated B12 and methylated folate is if you have at least two defects. I don't find single defects of those four possibilities to be something worth correcting. I have found double defects or more to be worth correcting, okay? So I don't think everyone needs methylcobalamin, all right? So, but to kind of summarize this up, if you have an MTHFR deficiency, getting methylcobalamin, either IV or regularly orally, I think could be beneficial. I do think taking oral NMN daily or IV NAD can help clean up your genes and get better genetic expression by working with those sirtuins I was telling you about. And I think glutathione is something very useful at knocking down, removing toxins and also lowering your cytokine levels. All right. So again, I haven't read her article specifically, but about those nutrients, those are my thoughts on that. Okay. So Sherry, did you have any comments about that? Oh,
Hi.
Sherry, yeah, there you
Yeah.
go. Yep.
Yeah. You're speaking really like a doctor tonight. I can tell you're at a medical convention. Boy, woo! I'm trying to write all these things down. Now, when you say MNN, am
Yeah,
I saying that right? MN as a Norman, N as a Norman?
it's in Nancy, Mary, Nancy, NMN.
Nancy, Barry, Nancy?
Nancy, Mary,
Ah,
so
gotcha.
M, and then N.
Gotcha.
Yeah,
Okay. No, that's helpful. Thank you so much.
yeah, okay. And yeah, and I can actually, I'll show you in case you missed my article. I'd be glad to show you that article here in just a minute then too. Okay. All right.
Thank
Yeah,
you.
actually, let me just do a quick screen share here for everyone. Let's see here. Okay, so yesterday again, I published a new article and I posted it within Lyme United, but I'll just show you it here. So it's this article called Longevity Interventions for Chronic Tick-Borne Infections and Mold Toxicity. Okay. And one of the things I talked about in here, I'm just getting to the section, was that you could use NMN to help stabilize your genetic expression and the genes. Okay. And NMN stands for nicotinamide mononucleotide, while NAD stands for nicotinamide adenine dinucleotide. So yeah, but NMN is dietarily stable and it gets turned into NAD. And the trouble with NAD is orally it's unstable and doesn't get absorbed well. But NMN, its precursor that gets turned into NAD, is very stable and well absorbed orally.
Thank you.
Okay.
Thank you.
All right. Let's go back here. All right. Does anyone else have a question about that or comment? All right, let's move on then. Thanks for our question, Sherry. All right. Hello, Teresa. Let's see. How long should I be on itraconazole as you had advised when I was thinking of mast cell activation syndrome? You were right. It was yeast. Also, can Lyme cause a positive ANA titer? Thank you. Okay. So what Teresa's talking about, I believe, if I remember the question from way back when, she had symptoms that were suggesting mast cell activation. So she was having a lot of allergy symptoms, I believe maybe even some rashes. And what I told her is that when you have chronic tick-borne infections and you're treating them, and suddenly you start getting a lot of symptoms of excess histamine, and those are being released by your mast cells, okay? That one of the first things to think about, especially if it comes on all of a sudden, is did you get too many yeast in your intestines? All right. So one of the biggest acute triggers of your mast cells are where histamines are made. Mast cells react if you're allergic to something and that thing lands on a mast cell, it triggers the mast cells to make all these histamines and release them. And then you get itchy eyes, runny noses. Sometimes your asthma kicks up. You can get skin rashes. You can get confusion. Those are histamine symptoms. All right. And in chronic tick-borne infections and in mold toxicity, just because you have those infections and because of mold toxicity, that also turns on your mast cells to make histamine. So our idea of how mast cells work have changed over time. It used to be we thought they just got turned on when you were allergic to something. Okay. What we now know is that when you have chronic infectious states or you have chronic mold toxicity, that also turns on your mast cells, and that those mast cells, in addition to making histamines when they get turned on, also become big cytokine factories. So it's another place that all those inflammation cytokines that your white blood cells make and trying to deal with the infection, your mast cells also become these huge cytokine factories as well too. And in the course of treating Lyme, sometimes our mast cells wind up getting too turned on by the infections and also by mold toxicity. But in my experience, when you suddenly start seeing a lot of mast cell symptoms in this disorder, think intestinal yeast first, because it also can trigger your mast cells. And all of us, because of being on herbal or prescription antibiotics, or having been on herbal or prescription antibiotics, that disrupts your intestinal bacteria and the intestinal microbiome enough that it makes it easy for yeast to grow, okay? And so sometimes the way you get your mast cells turned off pretty quickly is get your yeast under control, okay? So the itraconazole is an antifungal you can use to treat yeast. And typically when I'm using a prescription anti-yeast regimen, which is usually going to involve using nystatin along with itraconazole, or nystatin along with fluconazole, I want to treat those, use that combination for a minimum of 30 days. If you do have active yeast, it's usually going to take about 2 to 3 weeks before you see big improvements. But I have found the best thing to do is, if you are getting big improvements, you want to lock them in and be back to your baseline. And that usually takes 30 days. About 90% of people will respond to that yeast treatment really well in 30 days. Sometimes you have to go an additional 30 days if you're not turning around. Okay, so I hope that gives you the information you were requesting there. And then Teresa, in terms of anti-nuclear antibodies, so the ANA stands for anti-nuclear antibody. And what we're measuring is, are you making antibodies against your genetic material, right? That's not supposed to happen. All right, it's just not supposed to happen. Now so anti-nuclear antibodies against your own genetic material, is non-specific for any illness. All right, so we will see it in certain kinds of arthritic conditions like lupus. We sometimes see it, sometimes in rheumatoid arthritis, we might see it, but you also could see it in some infections. And it just so happens that the tick-borne infections are able to trigger positive anti-nuclear antibodies as well too, okay? So when you have tick-borne infections and you get an ANA that's positive, it does not necessarily mean you have classic autoimmune illness. Rather, this is something that when you get your tick-borne infections under control, often those anti-nuclear antibodies will go away, okay? There's something about, when we have autoimmune illnesses and you start making antibodies against your own body, the reason that occurs is that there are either amino acid sequences in these germs or fats that are in these germs that mimic identical patterns we have in our own body. And our response of dealing with these germs and their genetic material, some of their genetic material kind of looks like us. And so our bodies, in attacking those germs, starts attacking us as well too, okay? That's called mimicry. Molecular mimicry is the term we often will use for that. But once you get the infections out, the thing that stimulates that mimicry goes away, and often all those antibodies will go away as well too, okay? All right.
Quick interjection on that. I have always tested negative on that for a very long time. And out of left field, when this issue with the yeast started to show up, and the pain that I would have in my muscles.
Yeah.
Yeah. And then all of a sudden, if you recall, I went to the immunologist, allergist, when that issue happened with all my mouth getting burning and everything. And so, and that's when it showed positive, and it's never showed positive before. So that's why I was throwing that out to see where it come from out of left field.
Yeah, I would suspect it's not a classic autoimmune illness, rather as part of your infections, maybe even the yeast triggered it. But once you get those under control, that should go away.
Okay, that's a good thing.
Yeah.
Thank you very much. I appreciate
You're
that.
welcome. Good luck to you.
Thanks.
Any other comments there? Okay. Oh, Tracy. Yeah, I see your hand up there.
Hello.
Hi, Tracy.
I think you might have just answered my question. I was going to say, can it be triggered by yeast in the same way, an ANA?
I think it can. I've seen, let me put it this way. I haven't seen any science that says that, no scientific papers that say that, but my clinical experience says I have seen that before.
So that when people get their yeast down, the ANA normalizes.
Often it does. Yeah.
Good to know. Thank you.
You're welcome. All right. Thanks for the question, Teresa. Nice seeing you here again, too. All right, let's see. Sherry, you got a second question. All right, let's see what we got here. I find time spent in an infrared blanket helpful for pain. I have sinus migraines that swell my face, eyes, and lymph nodes. Does an infrared face cover exist? Do you think it would be helpful? Ah, interesting. So, so Sherry, infrared blankets, let's talk about infrared light first, what it does. So in terms of a heat source, when you put infrared rays on you from a blanket, or I bet there's a mask out there actually, what it does is that infrared light heats you equally at the surface level of your skin to a depth of about 1.6 millimeter or 1.6 meters deep, centimeters deep. Okay. All right. Which is a little bit different than like if you put a heat pad on your skin or you went into a sauna, the amount of heat that you have at your skin surface decreases as you slowly go deeper into the skin. So the thing that's nice about infrared is you get this deep heating down to, almost 2 centimeters deep. So about that much. And it's the same depth, it's the same amount of heat all the way down at the bottom of that. What that does, whenever you heat up an area in the body that way, that the body responds by dilating the blood vessels in that area, but it triggers a dilation of your blood vessels throughout your whole body, even in the areas deep inside you. So you get improved blood flow everywhere. All right. That means blood that can help clean out toxins. That means blood that can carry your antibiotics further into your tissues, for instance, too. All right. So sometimes I have to advise people when they're doing infrared blankets or infrared saunas, start low and slow, because you may find you're getting more Herx reactions at first because you're getting better blood flow deeper into your tissues. Okay. Now, I don't know, maybe somebody else here knows this. I don't know. I haven't seen an infrared mask. I bet somebody does do it. I know that there are companies that make infrared or red light therapy, which is different than infrared. They make red light therapy masks that are very useful at helping with your mitochondria. They don't necessarily heat you up the same way an infrared does. Does anyone know here, just wonder of our expert panel here, do any of you know if there are such things as infrared masks? I don't know. I would have to do a Google search on it, but I would bet it is something that you might find beneficial, actually. Did that answer your question, Maria Sherry?
Yeah, I'm actually asking these questions for my daughter.
Okay, all right.
Yeah, it's just easier.
Okay.
Yeah, okay, I'll tell her that. Thank you so much.
All right, very good. All right, let's see here. Hello, Mary. Hi, Mary. I haven't seen you for a bit here. I'm glad you're here. All right, let's see what you got here.
Dr. Ross.
Let's see. What was the outcome from your patients with Babesia oticoli after taking Zithromax, lumbrokinase, Mepron, tefenoquine? Also, how long did you typically treat for 1 year, 2 year, etc.? Lastly, how do you know you are not herxing for things other than Babesia oticoli? Good question. All right. So in terms of Babesia, the new kid on the block that we now know about, probably has been here forever, but we now know about, is this strain of Babesia called Babesia oticoli. All right. before we started realizing there was Babesia oticoli, the two major strains we thought existed here in the States was a strain called Babesia microti and another one called Babesia decani. Now, decani, we thought was predominantly a West Coast strain, although it's worked its way across the country. And microti, we thought, was everywhere, basically, all right? Now, microti tends to give you more acute Babesia and may not be so involved in chronic. That's what we're beginning to wonder, all right? Decani may be the same way too, but generally we think of both microti and decani may be easier to treat than oticoli, all right? And the reason is it looks like oticoli has the ability to sequester or hide itself away inside fibrin and create these things called fibrin nests. So your blood is full of a blood clotting protein called fibrin. Babesia oticoli recruits this fibrin and wraps itself up, it and a bunch of other germs, into kind of these fibrin nest, and then they get stuck on your blood vessel walls. And inside those nests, it creates all kinds of inflammation and immune reactivation, but the immune system can't get them too easily, okay? And the problem is with those fibrin nests is sometimes it just takes a year, 2 years, maybe longer to get rid of them. All right, in theory, all right? Now, the guy that taught us a lot about this is a guy named Dr. Henry Lindner. Dr. Lindner came to understanding Babesia oticoli as he was trying to help his daughter, and his daughter eventually passed away from it. She had it bad. And he had spent, I think, a good 2 or 3 years treating her with various amounts of lumbrokinase, an enzyme that breaks apart those fibrin nests, as well as using the tefenequin and Zithromax and Mepron. I think he had her on some artemisinin as well too, all right? But in her case, by the time he started treating her, she was so sick and ill from it that she did not recover. And I don't say that to scare you. I'm just saying that was her situation, okay? The reason I raise his daughter is it does appear that this oticoli, and we're just starting to get more understanding of it, that it is one of those strains that may take a longer time to get rid of if we're able to get rid of it, okay? What I have seen in my practice, Mary, and this is at a time when, as you know, I stopped practicing about 1.5 years ago. And at that time, we did not quite yet have the testing we have now that can suggest Babesia oticoli. All right, so IGeneX now has come up with a test that you can test to see if you have the microti strain and the decani strain. And then you also test to see if you have antibodies against the family of Babesia. They don't have the ability to actually test for oticoli specifically. But with their test, if you come up positive on the strain, but you're negative on microti and you're negative on decani, there's a high likelihood that that is because you're positive for the strain because you're positive for oticoli. So back then, I don't have any idea whether I had oticoli in my practice at all or not. Where we know oticoli is it's big in the Midwest, East Coast, and up into Canada, going above our Midwestern states as well too. I have not seen, and how we know about where it is from looking at deer studies, basically, what happens in deer populations, okay? So Mary, I guess there's a lot of stuff I'm saying here is we don't know what the total trend is here yet, okay? And I don't know in my practice whether I was truly treating people with oticoli. I suspect I was, because in theory, microti and decani should be more responsive to like 4 to 5 months of treatment and you're done. And for about a year before I left practice, I was using tefenequin for my, I guess, people that were having a hard time getting well in my practice. And within that group, usually I found about 4 to 5 months of that regimen was enough. There were a few people that were still taking longer, and I don't know what's happened with them since I left my practice. Right? So what I can tell you based on Dr. Lindner's experience, it's not uncommon to have to stay on these while you just slowly keep stripping away those fibrin nest so that more of the germs get exposed and you go in and kill them, basically.
Okay.
Did that
Mhm.
answer your question there at all or
Yes,
not?
it did.
Okay.
Yes, it did. So it took me a while to get up on the lumbar kinase,
Yeah.
like a few months. So now I'm up to one tablet once a day, one capsule
Yeah.
once a day. So, but I just started to feel herxing from that.
Yeah,
So I don't know when to increase it to 2 because
Yeah.
some of it was pretty severe.
I would, so instead of just going right up to 1 pill twice a day or 2 pills once a day, what you might want to do is build into it. So you could do like 2 pills one day, and then for the next 3 days, just do 1. And
Okay.
gradually add that in based on how you're tolerating it to get up to a second time a day. Okay.
Okay.
Yeah. But I talked with Dr. Lindner directly actually at the last ILADS meeting here about a month ago. And I was speaking with him specifically about his experience with lumbar kinase and nattokinase. And he tells me that with his daughter, in the end, she stopped having so much effect from the lumbro, and then he wound up adding in nattokinase on top of that. And he thought, based on his experience, the trouble is we have no science on that. I just want to be clear. So the best we can
Right.
learn is what other people see, okay? But he thought using natto with lumbro gave a really nice synergistic effect of those two enzymes, and you even got more. So what I would say to you is, let's say you get up to 2 a day of the lumbar kinase to break up the fibrin in your fibrin nest, and you stop seeing improvement, then you may want to go ahead and add some nattokinase into that as well too.
Okay. Okay. And one more question I have.
Yep.
Would you treat people who test positive to Babesia with tafenoquine right away, or would you wait? Would you treat them with atovaquone and zithromax first and then add tafenoquine if they didn't get better?
Yeah. So I'm putting on my how can I describe this? Putting on my hat of making sure that the people most sick get the medicine that need it, and recognizing that 2 things. Number 1, we still have a shortage of tafenoquine. We don't have adequate supplies of it.
Right.
And also wanting to make sure that if people do get resistant to these other medicines, I tend to think it's the right thing to do right now. And this may change in a year or 2 if we get a bigger supply and we learn more about working with tafenoquine. But I think it's better for acute to go with your standard Malarone with azithromax, or Mepron with azithromax, Mepron with clarithromycin. Those treatments first, so the atovaquone-based treatments first, and only if they're not working, then flip up to the tafenoquine. And I say that for
Okay.
2 reasons. Number 1, leave it for the people that need it. Okay, we have a shortage of it. Okay, and then secondly, it decreases the chances of getting resistance. Now, I got to admit, I have no idea if we're going to see resistance to tafenoquine or not, but it is a really great drug for some people right now. And I would hate to see that we're using it on easier to treat cases, if you will, and then taking that ability to use that drug away for the more complicated ones. And so I say that as a
Agreed.
doctor,
Agreed.
you know, with a social conscience, making sure we can help as many people as possible, basically. So,
Right.
yeah.
Agreed.
Okay. All
Okay.
right.
Thank you.
Yeah, you're welcome. Anyone have any questions there at all? All right. So the one thing I just want to say, oh, Tracy, I see your hand up, unless that's from earlier. Is that now?
That's now.
Oh, go ahead.
Just asking about herbal Babesia treatment for specifically microti. Would you say that's I know you have statistics that you say generally herbal treats so well. How does that stack up against microti in particular?
So I think if you're dealing with microti and you're dealing with Decani, based on my experience, I think crypto by itself or crypto with artemisinin, either one of those, I think gives you about an 80% chance of getting a person well versus an 85% chance to the prescription medications. Okay. So about a 5% difference. But you know, if
Okay.
you're in the 80%, so what, right? So I mean, it's not really that significant of a difference. The benefit of doing it is you're doing less disturbance of your good microbiome.
I know that sometimes, like for Lyme, the idea is that if it's acute, you know, you want to go with the traditional antibiotic.
So I think with Lyme, Borrelia, the reason to go with the traditional for an acute, like you got a tick bite, you got Lyme, that kind of acute.
Yeah.
We only have studies showing that doxy works. We don't have, and because of that, go with what we know works, right? That you don't want to become a person that develops chronic Lyme because you chose to use an herb that may not be as effective. And we just don't know. We don't have the data that tells us acutely that herbs are effective. We do have data, mainly it's mice studies actually, that tell us doxy acutely will stop 85% of this stuff from becoming chronic. So that's why I advocate going with the doxy in an acute situation.
So if it were an acute situation of Babesia, you're not, you know, running to traditional prescriptions. You feel like herbs are a fine place to start.
I think they are. I think they have a good enough efficacy to do that as a starting place. Yeah.
Okay. Thank you.
You're welcome. All right. Let's see here. Thanks for that question, Marion. Thank you too, Tracy. Let's see
Thank you.
here. All right. Hello, Sen. Let's see. Do you agree that glutathione feeds gliotoxin, so shouldn't be taken if you have gliotoxin? Sen, I haven't seen that argument. Can you explain more to me about that?
I can't. I just know that my naturopath said something about reading that somewhere or somebody telling her that. And
Yeah.
Tracy just messaged me saying that she'd heard that too from Neil Nathan.
So I'll just tell you what I know, okay? And I don't know whether there's some confusion or I'll have to see if Neil's starting to say that now. So I just heard Neil talk about 9 months ago at a conference in Austin, and this was not something he said then, okay? But what he did say there, and Jill Krista, who, you know, Jill is the naturopath that does a lot of, right? Jill and Neil teach courses together to medical doctors managing this. So they're kind of, they're a team when it comes to this stuff. And what they were basically saying is that when it comes to testing for the mold toxicity, there's two types of urine testing you can do. You can do the method that is done by Mosaic Diagnostics, which they use a type of method called gas chromatography. And then there is another method, which is kind of what's known as an ELISA method, which we take antibodies and we stick them on beads that hold on to mycotoxins. And that's the technique that's done in real time. So you got two different testing techniques, okay? They, both Neil and Jill like to challenge their patients to try to increase the chances of picking up the toxins. So they provoke toxin release before they do the testing, okay? Now, I don't agree with that, but they do, okay? They do it, all right? And I'd have to go back and look because I don't do any of this provoking. I don't know the next point I'm about ready to raise. With one of the testing techniques, I think it's the Mosaic, you do not want to do a glutathione challenge beforehand. I think the real time, the method is different and you can do a glutathione challenge beforehand. So and again, I may be wrong on which one it is, but the glutathione comes in depending on which testing technique you're doing, not on which toxins you're trying to treat. That was my understanding. I'll have to see if they've changed on what they're saying about that.
Okay, interesting.
All right.
Thank you.
All right. Sen, good to see you back here again too.
Thank you. It's good to be back.
Tracy said so too. Oh, I see. You guys were corresponding there. Got it. Okay, let's see. All right. Hello, Fran. Let's see. Hi, Dr. Ross. I'm back with an ongoing mystery. I have Bartonella and have been taking herbs and methylene blue for about 2 months. During my treatment, I decided to take Megaspore Biotic and developed hives all over my body. I stopped immediately and also went off all herbs, methylene blue supplements, and instead took Zyrtec, Pepsid AC, and isoquercetin. I thought the itching was under control, so I restarted the herbs after 3 days and added everything else one at a time. I then stopped taking all the antihistamines and developed itchiness, tingling, and pins and needles in my feet, hands, and arms. Could I be having a reaction to the herbs? Do you think I developed mast cell activation syndrome? Is this a Bartonella symptom? I am thinking of going off of everything and slowly reintroducing them again. I'm very frustrated and need some relief. I also have MTHFR gene SNPs. Okay, hold on just a minute. I want to read part of your question again here. All right, so you stop the and then you developed itchiness, tingling, pins and needles in feet, hands, and arms. So, Fran, how soon after you stopped your antihistamine approach did the itchiness, tingling, pins, and needles come back?
A few days, probably.
Few days, yeah. Boy, that sounds very much like a histamine effect. So the reason I'm saying that is the timing says you stop the things that block the histamines, you got all these symptoms back, and the symptoms you got back they could be excess histamine effect, basically, all right? So here's what I wonder. In that regimen that you were doing, somehow you did trigger your mast cells, and you were able to get them stabilized by being off of the medications and being on your antihistamine regimen of Zyrtec and the quercetin and the Pepsid AC. Okay, you had them stabilized, all right, but I think they're still turned on.
Well, you know what's interesting? I went back on all three again, antihistamines, and now it's just tingling, and it feels like neuropathy, but I don't know what neuropathy feels like, but it's my feet are cold, my hands get cold, but I have tingling pins and needles all around my body. So is that mast cell?
It may be, it may not be. And because I don't know for sure, if you were my patient, I would continue the investigation by telling you to stay on your antihistamine approach about another 2 weeks or so and see if that quiets down.
While taking all my herbs and methylene blue and everything? Or because I was thinking of just going off everything and reintroducing, starting at 1 drop of herb.
I would agree with that. But I think I would agree with that. But the reason I'm saying this is it sounds like when you were on all your antibiotics or antimicrobials again, and you were doing the antihistamine mast cell stuff, you were doing fine. Right?
It got better. It definitely got better.
Yeah. So I would say, let's see if we can get you back there. But I would stop the triggers of your mast cells for just a little bit, killing and all that may be triggering your mast cells. Just stabilize them for about another week or two, and then slowly start adding things back in again. Can I fully explain this? No. It's an odd symptom that you would be having just tingling, and yet the history says think mast cells, because this all came on after you stopped your mast cell supports. Do you see why I'm saying that?
Yes, but that itching is different from the tingling, so I didn't know if that was still a mast cell type of reaction.
So when your mast cells get activated and turned on, not only do they release histamines, they release tons of excess cytokines. Those cytokines could be leading to inflammation around your nerve roots, causing some swelling of your small nerves. And that small nerve, there's a condition called neurodermatitis, which is itchiness. That's different than histamine itchiness. It's a nerve itchiness, okay? And it may just be that with this excess cytokines coming from your mast cells being overly triggered, that it led to some inflammation around your small nerve fibers giving you the itchiness, right? So yeah, I would pull back, stabilize mast cells, stabilize mast cells, stabilize mast cells, and then slowly work back in again. I think that's how I would do it.
How much of a how much would my treatment actually be jeopardized by going off for 2 whole weeks after I've been on this stuff for 2 months? Like, I know Bartonella replicates every 24 hours.
So what I would say is ideally you don't want to stop your Bartonella treatment. However, there are times you have to.
Yeah. Well, this is kind of unbearable, like
Yeah.
the constant.
No, I mean, you're just going to have to retreat here for a little bit, unfortunately.
Okay.
Yeah.
All right. Thank you so much, doctor.
Welcome. I see a hand up here from Teresa. Yeah, Teresa.
My thought on what she's saying, what about when I get bad with the mouth situation, and when I was getting involved with the itching and so on and so forth, I used a histamine block in addition to the Pepcid, Zyrtec, and it's that DOA
Yeah.
enzyme.
So the DOA helps clear the histamines out quicker. So DOA it's a DAO or DOA? What does it say there?
I think it's DOA.
I think it is DOA. But DOA can help clear histamines too. So that's another supplement to think about using. I don't carry that one in my store, but yeah.
I got this off at Amazon. It's just a histamine blocker.
Okay.
Not that bad, price wise.
Great. Thanks for the idea. Yeah. Yeah.
Thank you both.
Yeah. Does anyone else have any ideas here? Hang in there, Fran. It sounds like you found a way forward. And the one thing I let people know, when things go haywire and we get you to a better place, we can always get you back there again. Okay. And so I just want you to know that. You may detour here a little bit, but you can get back there again. Okay.
Thank you, doctor. I appreciate that.
You're welcome. Good luck.
Thanks.
Hello, Laura. Let's see. Hi, Dr. Ross. I have BART, mast cell activation syndrome, and I'm a sensitive patient subject to serotonin syndrome. I am currently taking 5 micrograms methylene blue daily, titrating very slowly by adding in 1 microgram per week. What are your thoughts about trying an IV of methylene blue, and at what dose? Due to my sensitivities, should I wait until I'm able to tolerate a higher total dose of methylene blue? So I'm trying to think how to respond to this. So I probably am not, I don't think going for the IV is necessarily a good thing. All right. So I'll just start by saying that, and then let me try to round that out. So we give methylene blue IV in acute situations for people that have a condition called methemoglobinemia. And in methemoglobinemia, they are literally oxygen starved in their tissues. So in methemoglobinemia, your hemoglobin, which is supposed to carry oxygen in the middle of your red blood cells, doesn't release oxygen. All right. And so these people literally, they start turning blue because they may have oxygen in their red blood cells, but it's not being released. And we give it IV to knock that oxygen quickly off of that hemoglobin and get them oxygenated in their tissues. All right. Now, if we look at the availability of oral methylene blue versus IV, obviously, if you give it into your blood, it's in there. Okay. But the thing about methylene blue orally is it's very well absorbed, and it has good penetration right into the brain. It spreads easily out of the intestinal tract and goes everywhere. Okay. What I would be worried about by giving an IV of methylene blue is you're going to get a huge freaking herx beyond what you can control. And it's going to set you way back, especially with all of your sensitivities. The one thing that's nice about oral, you can control the rate, and you have a better chance of adjusting if you overshoot than you're going to have if somehow you've misjudged using the amount that you should be using IV. Okay. I will also tell you, most of us that are using it orally for treating Bartonella and treating Borrelia only have experience using it orally. I honestly don't know what the killing effect of this stuff is if you do it IV. I just don't know. I've gained my experience doing it orally, and I know how to adjust orally. IV, you're going to have, if you overshoot IV, it could really set you back for a long time, especially with the kind of sensitivities you have. And you have a greater chance of overshooting if you go IV, basically. Yeah. So, Laura, did that answer your question there?
Yes, hi.
Hi, Laura,
Yeah. Yes, it did. So, I have, like I said, I'm a really sensitive patient, so I'm trying to go really slowly with the oral dose. I know five micrograms is like nothing for anybody, but for me, it's a big deal to have to go up to 1 each per week, but it seems to be doing its job.
Well, let me put that in context for you too. So,
go ahead.
So I think I don't know if you've heard this before. Some of the people here will have heard this. So at one time, I was treating a person from Canada that was coming over to see me. That her docs up there had just bludgeoned her to death with antibiotics when she was hurting all over the place, and she got damaged by it. She was damaged. Okay, I mean the excess cytokines, it really hurt her, and it took a good year to climb out of that cytokine damage. But she was left with super sensitivity. We got her over her Bartonella and her Borrelia by doing, I think at most, 2 drops twice a day of Otoba, cat's claw, Hootenea, and Sida acuta. All right. Now, I don't know if you know, but I usually do 30 drops twice a day on those. Okay. So this is a person hypersensitive that I really used essentially nothing, nothing in terms of standard dosing. But here's what I think about that. Okay. I think in people that are super sensitive, yes, some of it may be MTHFR, but I think a bigger thing is they just have a hard time detoxing. All right. So what we're interested in when we give you a drug to kill germs is that you get enough in your blood. You get a certain blood level. Okay. And what determines that blood level is how much do you take in, and how quickly does your liver or your kidneys remove it? You get where I'm going here? Right. If you are a sensitive person, I think a lot of hypersensitive people, it's mainly a detox issue. That's what I think. And it isn't just the buildup of toxins. It means you can't clear out the drugs we give you as quickly either. Okay. Because they're toxins, right? And so in some people, maybe you, 5 micrograms a day of methylene blue may give you the right drug level you need to kill your germs. So the thing about a sensitive person is don't get so hung up on getting the doses everyone else does. Just take a dose that moves you forward and that doesn't clobber you to death at the same time. Okay. And the other lesson here, in her lesson especially, was this: you do not want to just bludgeon yourself to death with this stuff, because those cytokines damage you. Okay. So you do have to use caution in terms of how you move through the treatment, basically, too.
Very helpful. Thank you so much for your wisdom. I greatly appreciate it.
You're welcome. Good luck to you.
Thank you.
All right, let's see here. Hello, Sin again. Let's see. GLP-1 probiotics seem to increase my appetite. Have you heard of a paradoxical reaction to this product? No, I have not. So what Sin's talking about, there's a probiotic product we have that has Akkermansia in it primarily, called GLP-1 Pro. And Akkermansia helps increase your intestinal production of GLP-1, which many of you know. Those are there's a current class of drugs we're giving that increase GLP-1 as well too. And so this probiotic potentially could help with weight loss by increasing GLP-1, but I haven't heard of anyone getting increased appetite from it before. I don't know. Yeah. I think there's a rule I have in medicine from managing this crazy illness long enough that anything can happen to anyone with anything.
Okay, fair.
All right. Good luck to you, Sin.
Thanks.
Hello, Cheryl. Let's see. I think I may have yeast and or leaky gut, possibly MCAS. I was reading your articles. I've been constipated almost 3 months and then loose stools and now very gassy. Also much inflammation, sensitivities, immune suppression, and increased symptoms. I'm still having a buzzing in my ears. Could this be another symptom from one of the bees? Also, a sore bump popped up in the very back of my mouth twice now. Is that a sign of something? I started metabolic daily and full doses of Capri Plus and still taking very low doses of herbal antibiotics because of sensitivity. What's the best way to take them for the best benefit? How far apart? I'm increasing my fiber and taking L-glutathione and curcumin. Anything else that could be a priority? Anything to help me sleep with this buzzing in my ears? Thanks for all you do. All your information is so helpful to try to figure this out, Cheryl. Thank you. All right, Cheryl. So one of the things I have found in my practice is when somebody is at a better place and they go backwards, think yeast, think yeast, think yeast. Okay. All right. And think intestinal yeast. And here's why. So when you have tick-borne infections or you have mold toxicity, the reason you feel poorly is the major reason you feel poorly is the immune system and trying to get rid of those infections makes too many cytokines. Now, cytokines are good and bad. On the good side, they turn the immune system on. On the bad side, excess cytokines give you headaches. They make you so you can't sleep. They make you hurt all over. They give you fatigue. They make it so you can't think. They may give you joint pain, etc. Okay. So if your symptoms of what looked like your tick-borne infections got worse, think yeast. Okay. In addition, if you've suddenly gotten a lot of gassiness and bloating and changes in your stools, think yeast. Other symptoms that make me wonder about yeast are going to be increased sugar cravings, intestinal gassiness and bloating, new sores, either oral sores like you described there, or pimples or acne or increased skin rashes. We seem to see those come up more when you get intestinal yeast as well too. And then finally, in a woman, having increased vaginal itching or vaginal discharge. So I agree with your approach of thinking this is yeast. I think you're right in that, okay? In terms of how quickly this will turn around, if you're using the Capri Plus as your anti-yeast medication, it may take about a month before you start turning the corner, and it can take about 2 months to totally get over this. You still can stay on your herbal antibiotics, so I want you to know that, because often doing that with the Capri Plus, you're going to get better. If you wanted a more quick way to resolve your yeast, instead of doing the Capri Plus, I would look at seeing if you can get a prescriber to help you with nystatin and diflucan. That combination usually will clear yeast within about 30 days. And most people within 2 to 3 weeks of starting it are going to have significant improvement as well too. Okay. In terms of timing things, your herbal antibiotics and your Capri Plus, you can take at the same time. Your metabolic daily should be taken as far away from your germ killers as possible. So if you're taking your herbal antibiotics and your Capri Plus in the morning and at night, somewhere in the middle of the day, put your metabolic daily in there, basically. Okay. All right.
Okay.
Did that answer your question for you?
Yes. Yes. That's what I was thinking. It was after I read your thing. I was like, that I think that's what's going on, because everything that I have is in there.
Yeah. No, it sounds like intestinal yeast. Yeah. What I have found, about 80% of the time that people go backwards, it's yeast.
So you don't think it's leaky gut though?
Well, leaky gut will be part of yeast. And the way you're going to get your gut to heal up is get the yeast under control.
Okay. So the metabolic daily, that's what I should be on, right?
Yes, because as a result of yeast, it has triggered leaky gut. And so, yes, the metabolic daily is a good probiotic to help with that. And the reason, so the various bacteria that are in the metabolic daily, Akkermansia, and you've got some other strains of Clostridium and some other bacteria in there that help produce butyrate. Those that production of butyrate that you get out of the metabolic daily, butyrate is a chemical that is used by your intestinal cells to heal and fuse back together so they don't have their gaps. In other words, heal the leaky gut part of it. But ultimately, to heal a leaky gut, you got to get the yeast out of there, the excess yeast out of there.
Okay. Okay. Yeah. And as far as me taking, like, what I'm taking is like 2 drops of Japanese knotweed, 2 of crypto, and 1 of Houtinia. And I try to get that twice a day is pretty much what I've been doing. Is that, I guess that's enough, I guess.
If that's enough. Again, remember, as I was saying before, not everyone can get to the top doses. You've got to take what you can handle and is going to move the needle forward.
Yeah. And as far as sleeping with this buzzing in my ear, like, I just got to get that yeast under control. Right.
If it came on with the yeast, it's probably due to excess cytokine inflammation in your body. And so it should get back under control. Buzzing, be aware, buzzing is also made worse by alcohol and caffeine. So keep that in mind. And then I don't think, if I remember correctly, you're not on any prescription antibiotics at this point. Is that correct?
No.
I mean, no, you're not on any prescription antibiotics.
I'm not on any prescription antibiotics, no. Just the herbals.
The reason I was asking that is the macrolides, which are called clarithromycin and azithromycin, sometimes give you ringing in the ears that is actually nerve damage. But as long as you're not on those, then you're okay.
Okay. Okay. So as far as the tinctures and them having alcohol in them, I've been like putting them in hot water, and that helps get rid of the alcohol.
It'll steam off the majority alcohol. It doesn't get rid of 100%.
Okay,
it's not going to hurt. It's not going to hurt. If you're asking, is it going to hurt your yeast treatment? No.
Okay. Okay. Sounds good.
All right. Good luck to you.
Okay. Thank you.
Hello, Sundar. You know, I may mess up how I say your name. Can you say your name for me? Is it Soundaria? Well, I hope I said it right. Hi, Dr. Ross. Can you please share a protocol to detox mycotoxin? Can this be done in conjunction with the Lyme herbal antibiotics and a COVID spike protocol? If not, what should go first? Thanks. So I don't think we really know the best binder to bind up citrinin, but most of us are going to use a product that has a combination of binders in it. So you could use either a Mycotox by Research Nutritionals or GI Detox Plus by Biocide and Botanicals. Both of those are pretty similar products. They have some clay in them. They have some humic acid, fulvic acid. They have some charcoal in them. So it's a broad spectrum binder, has a number of things in it, so you can get at various toxins, okay? And so, yeah, you can easily do that in conjunction with taking your a COVID spike protocol and other protocols that you're doing as well, too. The only thing about your binders to keep in mind is they're binders, okay? So they're going to bind up medicines and supplements if you take them at the same time. So I advise people to stop their prescription medicines and supplements beginning a half hour before you take your binder. And then you can resume taking your prescription antibiotics and your supplements 2 hours after you take your binder, okay? You can actually have food anytime, but the ideal time to have your food or a small snack is 30 minutes after you have your binder. And the reason for that is some of the toxins that the liver processes get moved into your gallbladder. Whenever you eat, your gallbladder squeezes and pushes out its contents into the intestines. And the location of where it pushes its stuff out into the intestines is 30 minutes downstream from the stomach. All right. So if you take your binder, it goes to the stomach. 30 minutes later, it's worked its way downstream to where the gallbladder releases its stuff. That's when you want to eat, basically. Okay. Any other question there? Does anyone else have a question to clarify that? All right. Hello, Anna. Let's see. I'm currently doing Rocephin and azithromycin, both IV, atovaquone orally. I just confirmed recently positive IgM Babesia and indeterminate for Lyme and Bartonella. Thoughts on current treatment, although oral med will be changed at next visit. What does indeterminate mean? Can these medicines or infections cause the following: loss of taste, ear ringing, stabbing and burning, eye pain with floaters? If so, how much can these be resolved? All right, let me try to, you got a lot of questions here. Let me try to take this one. I'm going to look at this first section here first, and I'll come back and look at those other ones. So I want you to be aware that the azithromycin can give you ringing in the ears that may not resolve when you stop the azithromycin. So if you did not have ringing in your ears before you started the azithromycin, you may want to talk to your physician and let them know you're having ringing in the ear so you two can come up with an alternative solution, okay? On the other hand, if you already had ringing in the ears and it's not worsened by using the azithromycin, then I think it's still okay to be on the azithromycin, okay? All right. So you've got a positive test for Babesia and indeterminate for Lyme. All right. So from what you've told me here, I can't tell whether you really have Lyme disease or not. Okay. A test is not how you diagnose Lyme. A test gives you information that you can use in trying to determine if somebody has Lyme, but it's just one piece of the puzzle. The way to make a Lyme diagnosis is to consider, is this a person that either got a tick bite or could have run into ticks that carry Lyme? So do you live in New Jersey where 95% of ticks carry Lyme? Okay. Or do you live in the tundra of Alaska where there probably aren't any ticks that are going to give you Lyme? All right. So we have to consider, what's the risk of getting Lyme? Okay. Secondly, do you have a lot of symptoms that look like Lyme? Third, are there any physical exam findings? And fourth, do you have a lot of symptoms? Okay. So if you have a lot of symptoms of Lyme, being fatigue, muscle achiness, joint pain, thinking problems, and you have an indeterminate on your test, it's possible you could interpret that as being a weakly positive test, because sometimes when you have active Lyme, you get immune suppression and it makes it so the test will not be positive. So if you have a lot of symptoms saying Lyme, that indeterminate might be a weakly positive test, okay? If you have Lyme, the combination of azithromycin along with Rocephin is really good at treating spirochete and intracellular Lyme. That's two forms of the germ, but that treatment is not doing anything to deal with the third form of the germ, which is called a cyst form of the germ. In addition, the Lyme germ has different growth states. So these spirochetes, forms that live inside of your cells, and microscopic cysts can either be growing or they can be hibernating. And then we call those hibernators persisters. And this treatment does not have anything in it that's dealing with persisters. All right. On the other hand, if your main problem is Babesia, the atovaquone coupled with azithromycin is a good starting place to begin a Babesia treatment. So this looks good. Okay. So in terms of your symptoms, the loss of taste, ear ringing. So did all of these, if these symptoms all began with the medications, especially the ear ringing, think azithromycin toxicity, stabbing and burning and loss of taste, those are neurologic, which could be from a Herx reaction. Sometimes atovaquone gives you neurologic problems as well too. All right, so the bottom line is, I'm not going to solve this problem for you in a quick webinar. I think you need to talk to your doctor and have them and describe to them what these symptoms are you're having, and help and sit down with your physician and determine whether you need to change the antibiotic regimen you're on or not because of some of these symptoms. Okay. I don't have the time to solve that in a quick forum like this. All right. Anna, are you there anywhere?
I am.
Yeah. Did you see what I mean by that?
I do. And it's just so frustrating. And I know you can't go by tests, but MDL did test positive for Lyme. And I felt like the first time around I did the PIC line from like April to September, I did like azithromycin, ertapenem, and atovaquone, and everything pretty much resolved with symptoms to like, except for like my tingling, which was like at 90% better, right? When I got off, I had a relapse. I went back on the PIC line. I went back on azithromycin, but I did Rocephin and then atovaquone. And then midway, we changed the azithromycin to Doxy. But then in the interim, we got the IGeneX results, which came back with the whole Lyme. Like some bands were positive, but certain bands were IND. Like I'll get more clarification tomorrow for the Lyme. Bartonella was indeterminate, but the Babesia was positive. So therefore he changed the Doxy to azithromycin. And it was shortly, a couple of days after azithromycin, I developed the ear ringing, which I've never had before.
Okay, I got to tell you right there, that's the azithromycin.
Yeah, so it's been about a week now that I've been, less than a week with the ear ringing, and you know, I'm just concerned about that. I've never had that before. And then the loss of taste, you know, everything tastes the same, chalky, like.
When did that begin relative to
that started probably a month ago, and I think it was right around the start time of Doxy, give or take. But I don't know if it was the tinindazole that really started that, because I kind of hurts from a quarter tablet.
So I can tell you right now, I'm not going to be able to sort this out for you.
I'm a mess.
Yeah, well, it's not that you're a mess. It's just that this isn't this is more a setting that works better for quick, isolated questions. There's a lot to decipher here with you on this. Okay. What I can tell you is this: talk to your doctor about azithromycin and the ringing in the ears. Okay. Yep. Talk to your doctor. The atovaquone is fat soluble, and things that are fat soluble concentrate up in the brain, and sometimes can concentrate in the fat covering of the nerves in the brain, which is called myelin. And when it concentrates in the myelin, sometimes you get neuropathies related to that and dysfunction of the nerves related to that, which what I'm wondering is some of this taste issue and some of your neuropathies coming from the atovaquone.
Okay.
Because just raise that with him, okay? Or who here. Yeah. Okay.
Okay. All right.
All right. Good luck to you.
Okay. And as far as the other questions, just real quick, like, can steroids with someone with Lyme co-infections cause like issues with heaviness in the body, numbness, stiffness?
So steroids in and of themselves will not give numbness and stiffness. However, steroids suppress your immune system and can allow your tick-borne infections to get a lot more active.
Okay.
Steroids are usually not a good idea to do with somebody that has tick-borne infections.
Right. And so I just have to like let it run its course, you know, because they put in 16 grams of steroids in me. So
yeah, you don't have a choice now. The best you can do is to try to get your germs back under control. I know you're working on that. You're trying to find the ideal regimen to do that. But
right. Okay. And then as far as like cervical spine issues, like Lyme can exacerbate that, or?
So if you've got, Lyme likes to live inside joints, and Lyme likes to live in scar tissue. Lyme likes to live in areas of poor oxygen. And it is possible, and Lyme is everywhere. I mean, and all of us have it everywhere when we get it, okay? So it's possible that your Lyme has gotten more active in your joints and you're getting more joint pain because of that.
Okay. All right. Okay, thank you.
All right. Good luck to you.
Thanks.
Hello, Lisa. Let's see. Can you comment on the effectiveness of Alinea for biofilm and fibronest in the treatment of Babesia and Borrelia? I need to drop off at 40 minutes into the Zoom tonight, so I may not see your response until tomorrow. All right. I'll answer it anyhow, Lisa. I saw you here earlier, by the way. And I know you're going to watch the recording of this. So basically, Alinea is an antiparasitic that is useful for treating parasites in the intestines. Some doctors will use it to treat Babesia, although because it's antiparasitic, Babesia is a parasite that lives in the blood. We actually have no studies that show it works on Babesia. I just want you to know that. I, at one time, did try it for my Babesia treatments, and I did not find benefit from it. In my clinical practice, my experience, it doesn't work. As far as, and then in terms of for Borrelia, there is only one study where they have used Alinea as part of a Borrelia treatment, but they used it in conjunction. I think there were about 3 other antibiotics used, and it was really hard to tell whether the Alinea made any difference or not. The bottom line is, I don't even know if Alinea is helpful for Borrelia either. We have laboratory evidence of many other antibiotics and herbal antibiotics working. We don't have adequate data on Alinea being something effective. We have absolutely no evidence that Alinea treats biofilm or fibrin. So I would not be using Alinea as part of a Babesia or Borrelia treatment. I just don't do it. I think there's better ways to approach those problems. Okay. All right. And Lisa, if you were here, I would ask you questions, but I'm sure we'll hear more from you too. Okay. Thanks for the question. All right. Let's see. This is from somebody. Somehow somebody's question is showing up as from iPhone. Anyhow, I'm not sure who that is, but here's the question. Some people with Lyme take ivermectin. What is your opinion of using ivermectin to fight Lyme disease? So ivermectin, for lack of a better way of saying it, there is a group of people out there that thinks it treats everything, right? So in the pandemic, we thought it treated COVID. And before the pandemic, people thought it might treat Lyme. But the simple truth is ivermectin is designed to treat parasites in your intestines. There is some weak evidence that it might be useful in long COVID at blocking the spike protein, okay? The data about whether it's really useful in acute COVID, I think is mixed and heavily biased by the researchers that all wanted it to have benefit, and their interpretation and design of their projects is really skewed. And so when I look at the data on ivermectin for acute COVID, I don't think it supports using it, okay? I contend others have a different opinion on that. When it comes to ivermectin and tick-borne infections, there are one study that shows it may be beneficial against Babesia. There are 0 studies showing in a lab or in humans that it does anything for Borrelia or for Bartonella, okay? Now, I know there are people that use it for Borrelia, and I know that some people report getting better when they use it. But I think what's going on is I don't think it's killing germs. Ivermectin is a very potent cytokine regulator, actually. It helps lower cytokines. And so when people feel better on it, I think it's because it's modulating inflammation from cytokines rather than in tick-borne infections, rather than it having a true killing potential. Because I know that there is research supporting many herbs that I recommend and prescription antibiotics I recommend that actually show true benefit, I don't use ivermectin. I think there's other things that we have better possibilities of using. Secondly, when I have had people that have used ivermectin that was started by other providers, I have not seen long-lasting benefit from using it. I don't see that it moves the treatment forward when it comes to tick-borne infections. Okay. So I don't do you have any questions about that?
Yes, my name is Sharon Wilcox, by the way.
I see you there, Sharon. Hi.
Hi. Yes, I live with chronic severe body-wide pain. I've had Lyme for 40 years.
Yeah.
And the only thing I use to deal with it is hydrogen water. So what do you recommend for just living with the chronic pain?
So if you know, identify your tick-borne infections and kill them, number one. And I don't mean to sound glib about that. I mean, be on herbal antimicrobials that will start knocking your germ load down. Okay, number one. Number two, you need to take something that's going to help lower inflammation in your body caused by these tick-borne infections. And so I like working with curcumin.
Okay.
That is 500 milligrams 3 times a day. Something else you may find beneficial too, especially if there's a lot of musculoskeletal pain, is to use the peptide called BPC 157. BPC 157 is a peptide made in our stomach lining, but it has very useful at repairing injured musculoskeletal tissues, and including joints. And it also regulates the immune system to decrease cytokine production too. And so you would want to do 1 pill twice a day on that. It also has some weak antimicrobial properties as well too. Okay. So I would,
Okay.
and the last thing is if you're not getting sleep, do what you can to improve sleep. All right. If that means taking herbal medications to do it, if it means doing prescriptions, when you get sleep, sleep lowers cytokines, but sleep also changes your brain's neurologic management of pain and how you live and deal and feel pain as well too.
Okay. Thank you.
You're welcome. Good luck to you, Sharon.
Thank you.
Yep. Hello, Hong. Let's see. I have had Lyme disease for 15 years. I've not been treating it for several years. Most of my symptoms are headache, scalp, and neck and spine pain. I have a white lesion on my brain MRI. Could this be due to Lyme or other infections? I also have EBV, CMV, and HHV6 activation. Recently, I had a lot of stress. I'm back on treatment using your herbal treatment. I've been taking cat's claw, biocidin, and otoba bark, 1 dropful each for 2 weeks. I'm experiencing Herx reaction. Herx is getting better. Is this what you would recommend? I also taking antiviral herbs as well. Any antiviral you recommend? Maybe one-on-one conversation on the topic below might be good. I run a biotech startup with a gene therapy technology, which could potentially deliver and express any genes encoding for protein peptide therapeutic. Interesting. Well, that's it. That would be a separate conversation, but thank you for letting me know that. So Hong, I can't tell which tick-borne infections you have. Okay. If you know that your tick-borne infection is Borrelia, Lyme, then I do think a combination of cat's claw, biocidin, and otoba bark is good. That combination, the biocidin, is going to get rid of your biofilm. The biocidin also has some oregano in it. Oregano can help treat persisters. The cat's claw can treat growing and persisting forms of Borrelia. The otoba bark, we don't have any science on it, but likely it at least goes after growing Borrelia. Okay. So if your objective is just Borrelia, I think that's a fine regimen. You had a Herx. Sounds like you're getting over it. So it sounds like it's doing something for you. On the other hand, if you think by your history and by your testing that actually you've had Bartonella and Babesia and Borrelia, then I think a better regimen herbal would be to do a combination of Cryptolapis plus Japanese knotweed plus liposomal cinnamon clove oregano. The Cryptolepis, if you have Babesia, you want to take at least, as part of your problem, you want to take at least a teaspoon. You want to work up to a teaspoonful 3 times a day. Cryptolepis treats growing and persister Lyme and Bartonella. Cryptolepis is one of our best agents for Babesia. The Japanese knotweed, you would work up to 30 drops twice a day. It's very effective against growing and persister Bartonella. And then the liposomal cinnamon clove oregano is great for growing and persister Bartonella, and it strips out biofilms, and it is the clove in it can be helpful for treating Babesia as well too. All right. So if you're looking for a regimen that's going to go after the 3 tick-borne infections, that would be better than using your cat's claw, biocidin, and otoba bark. All right. Okay. And then in terms of the issue of EBV, CMV, and HHV6, I take a different perspective than a lot of my colleagues do. So I acknowledge that the viruses, the EBV, CMV, and HHV6 live in people. They live in healthy people. In fact, if you were to do antibody testing against these 3 viral infections of people that identify themselves as healthy, you'd find evidence of antibody reactions against these viruses in at least 20% of people, maybe 30%. So just having antibodies in you for these infections does not prove they've reactivated. It just may be your body doing a good job keeping them under control. All right. I do acknowledge it is possible these viruses do activate. However, we don't have any decent testing that proves they've activated. My approach has always been to go after the tick-borne infections first, which eventually gets your immune system working better so that then the immune system will put the viruses back under control. Okay, so that's what my approach has been. But if you were to want to do something for the viruses, I like using olive leaf extract at 500 milligrams 3 times a day, and then working up to 1,500 milligrams 3 times a day. And I also want to use reishi mushrooms with that, 400 milligrams 3 times a day. Reishi turns on the antiviral part of your immune system. Okay. So those are my thoughts. You may just be good enough just going after your tick-borne infections and see where you get, because again, the immune system may just turn back on and put the viruses under control. Okay. So Hung, did you have any questions there?
Yes, I do. First of all, I find this forum, this is my first time, so refreshing, and having a doctor talking to us like we're actually knowledgeable about it.
Yeah,
just
thank you.
refreshing.
Yeah, thank you.
Yeah, so appreciate the forum. I was definitely diagnosed with Lyme, and anaplasma, a leak here, borderline, Rocky Mountain spotted fever, depending on the labs.
Yeah.
Babesia has been indeterminate. Bartonella, based on symptoms, I was diagnosed by other doctors.
Okay. Yeah.
So I have a lot of these co-infections, but
I would I would think about changing up your treatment then, going to that crypto and the knotweed and the cinnamon clove oregano then.
right. The crypto, I took it before. I didn't see much improvement. And I also read somewhere that it could alter DNA. That was a while ago, many years ago. Have you read about that? Do you worry about that?
I'm not worried about it. The studies that did that used it, I believe it was mice studies, if I'm right, and they just like dumped gazillions amount of crypto on them. And so the problem with some of these studies that look in animals about possible cancer effect, they're often using astronomical doses beyond anything that would be comparable in using in a human, basically.
I want to get tested from IGeneX you said the test has gotten better. Mine was 10 years ago. So which doctor, you mentioned doctor, somebody who still does the most, active treatment, follow your philosophy, that I could go to get the order placed for IGeneX.
Where do you live?
I live in San Francisco Bay Area, San Diego.
Okay. Yeah. So you have there's a number of doctors out there. They're extremely expensive, unfortunately. There's a group north up in Santa Rosa called the Gordon Medical Clinic. And out of that clinic is Eric Gordon. And there's a physician there named Steve Harris. The trouble is they have a pricing model that I think you're going to have to pay thousands of dollars up front. Okay, but they're good.
Long wait.
I know, but I'm just
telemedicine.
What now?
You were mentioning some doctor who was can I do telemedicine with that person?
I don't know whether these people will do I don't know of anyone that does telemedicine into California, actually. In terms of this is California, but it's way south, and I don't think you're going to like it. There's a naturopath down in San Diego that's reasonable with her prices.
I go to
And
San Diego a lot.
yeah, so San Diego is a possibility for you. And her name is Nicola McFadzean.
Can you type in the chat?
I'm gonna bear with me. We're gonna look together. I'm gonna show you because I gotta make sure I'll find it for you. Just a minute. I'm gonna do a screen share.
Okay, sounds good.
So Nicola has been treating Lyme in San Diego for a while. She works in a similar fashion to what I do, and she's not as crazy with her costs the way that that Gordon Medical Group is.
Mm-hmm.
Let's see if here she is. Okay, so her clinic is called Restore Medicine.
Mm-hmm.
Okay, and her prices are I don't know what her prices are now, but they always have been historically a lot less crazy than the Gordon Medical Group.
Mm-hmm. Yeah.
Okay, so you might talk to her. And I know she does work with IGeneX testing in terms of getting accurate diagnosis then too.
Mm-hmm. Yeah. I also, tested Dr. Fry's bug. He said I have it. I also went to a microbiologist. She said I have nematodes.
Yeah.
So do you have recommendation? Is Dr. Fry's bug real? And the nematode, what do you do to treat those?
So the nematode, I would want to see the testing that they saw that they came up with that said the nematodes were there. I would want to verify that myself before I would treat. Okay. But Dr. Fry's, what is it? FL13776, whatever he named that thing. I think he found, years ago was trying to come up with what he called Bartonella inside of blood cells. And in the end, when his treatments for Bartonella weren't working, then he decided this really wasn't Bartonella he was seeing. It was this protozoa parasite called FL133, whatever. And then he started coming up with all kinds of treatments to go after it, and people would get better. But when you sat down and talked to people, they all had Bartonella, Babesia, and the things that Fry was doing to treat their FL1, whatever that thing is, all treated Bartonella and Babesia. So most of us don't think I think what he has found is an organism that lives in people that is something that cohabitates in us. I don't think finding it means it's a problem.
Mm-hmm. I wondered too.
Yeah. None of us really follow that protocol or believe in that anymore.
Okay, good. So what test would I have to do to test for a nematode? Because the microbiologist saw it, and many of them, and said he's convinced.
Was it a physician or a microbiologist?
Microbiologist.
And how did they diagnose? Was it a microscope exam they did?
Yeah.
What did they do?
Yeah, with live blood, a drop of blood. And she actually took videos of that, pictures of it.
Oh, huh. I don't know how I would handle that. I would have to think about it. You might want to, when you talk to Nicola, see if she has some ideas for you.
Mm-hmm. Okay.
Okay.
I do have some follow-up questions based on your previous conversations with other. So you mentioned there is this Capri or something for the gut. Can you type that? Because I want to buy that.
So it's called Capri Plus. All right. So this is my store. And this is the product. Okay, so it's Capri Plus.
Okay, Capri Plus, I got that. And then you mentioned there's for the GI detox, you mentioned the GI detox. I have that one. And then you
Okay.
mentioned hello, are you there?
Yeah, I'm here.
Then you mentioned the second one for
Yeah.
detox with all sorts of folic acid and stuff like that. Can you
This
show me the other one?
right there. It's called Mycopol.
I cannot see your share anymore.
Huh.
Oh, hold on. I got it. Just give me a second. Let me just grab it. Okay, Mycopol. Okay, so if I do the detox, the GI detox and Micropol, then it probably should be good enough, right? For now.
I think, yeah, I do think so.
Okay. Oh, that's very helpful.
All right. Okay. Listen, we're at 5:36. Well, actually, I'm in San Diego. It's 5:36. It's later. I'm gonna call it for tonight, everyone.
Dr. Ross, it's Ken Nixon. I'm sorry to butt in, but
Sure.
a technical problem. I couldn't get on until 10 to 8 tonight. Does that mess up your system?
No, doesn't mess it up at all.
It does it automatically. You didn't have to
No.
let me. Okay, thank
No,
you.
I'm sorry you couldn't get in. I'm glad to see you.
Oh, yeah, no, I had a problem getting in to getting to my computer, and then I hesitated to come in the middle of your program. So
Oh no, I have no problem with people coming and going. It's no problem at all, Ken.
Okay, thank you.
You
Good
take
luck.
care. All right.
Thank you.
Thank you so much.
Yeah, good luck to you, Hong.
Yeah.
Good night, everyone. It's been good being with you here tonight. Again, look for the recording sometime around 9 to 9:30 a.m. Pacific Standard Time tomorrow. And then we have another one of these next week. So if you want to take time to RSVP for next week's session, that would be good too. All right. Good night.
Good night.
Bye-bye.
You.
Thank you.